This is for Dr. Paraino. How many times can a recipient accept kidney transplant if, for example, the donated kidney is rejected by the recipient?
That's a very good question. Regarding kidneys, the most transplant that I observed personally at the National Kidney is 4 times transplanted. Multiple times if you want, as long as the kidneys are matched to you and you don't have any antibodies to reject the supposed kidney for you, you can do it multiple times. The most I've observed was four kidney transplant.
Another question for Dr. Paraino. Is a patient recovered from COVID-19 eligible to donate kidneys?
Yes. Actually, we are on the technical working group together with Dr. Aliquete regarding these types of donors, may it be living or deceased donor. With living donation, we require the donor to recover a month after the exposure or suffering from COVID disease. But with the deceased donor, we really don't know because the patient doesn't talk. So we just rely on the gene expert COVID test to know if the patient is actively suffering from COVID or not. If not, we can actually do the disease donation. But with living donor, 1 month after the infection.
Having recovered from COVID-19, is it necessary to be COVID negative?
Yes.
Yes.
As of now, yes. It's because we really don't know the outcome of COVID transmission in transplantation, and we have cases who have complications in the transplants when they have COVID. So it would be better to avoid transplanting kidneys coming from COVID active infected patients rather than, we go by safety, because our number one problem with kidney transplantation because of immunosuppression is, of course, infection.
Follow-up question, Doc. How did the pandemic change living kidney donation in our country? How did it impact kidney transplantation in our country?
Definitely, it decreased, no? Ang kidney transplantation. Practically zero, especially in 2020, in the first 3 months, 4 months, 6 months, actually. Then later on, we started to have the transplant for the living donation, but not for the cadaver yet, because we don't know where these referrals are. And we also have to protect our healthcare worker. Now, for the living donation, when we resumed our living donation, we had problems like the workups are all finished, and then when about to admit, we have to do the swab test, right? Sometimes the donor would turn out to be positive, or sometimes the recipient would have positive swab test. So remarkably, we decreased in our cases. It's just this year, 2021, that I can say that we are having more cases now for transplant.
There's an interesting question here. If a person has an advance directive that he will donate his organs, but then after he dies, his spouse is not in favor of it, so who will prevail?
Actually, we follow the will of the wife, even if there's a written directive, because we don't want to do conflicts with the ones living or being left behind by the deceased donor. But we will try our best to convince the wife or the living relative of the deceased donor that the donor has intentions of donating his organs. So we will try our best, but if ever the consent will have to be signed by the spouse. So we really can't do anything about it unless they change their mind.
What are the ethical issues involved in organ donation? For example, if there is money involved?
Every transplant program should have a hospital ethics committee. And that's where we sort of screen out if this is not truly altruistic donation. For example, especially for the living non-related, uh, our ethics committee has a way of screening, extracting from the donor or from the recipient. Paano sila nagkakilala, and then there will be some inconsistencies in their answer. For example, one is from this province, one is from this another province. How could it be that they know each other? More so if the patient is from this country and the another patient is from another country. That's one way of looking at it, no? In the worst scenario that we had before of this living donation. So, and the rules in of the ethics committee was guided by the Department of Justice sa IACAT. Sila nagbigay sa amin ng mga forms on what to fill up, no, as requirement. So we parry away this commercialism in organ donation.
Okay. Thank you, Dr. Alicante.
The world moves in real time. So should our healthcare technology. With information needed, decisions to make, and experience to share. Every second counts. Live integrated tele-ultrasound enables real-time communication, remote collaboration, confidence, knowledge, and learning. The first ever integrated tele-ultrasound collaborative platform. Philips Lumify. Integrated tele-ultrasound, powered by React's collaborative platform. Innovation and you, Philips.
So for Dr. Paraino, there is this recent news about a person getting a heart from a pig, a heart transplant from a pig. So, um, what
The-
yes. So you mentioned doctor earlier about the
yes,
xenograft.
yes.
So this is
That's
actually
actually
an
the
what do you think about this?
this is actually the talk of the transplant community right now. These are not simple pigs that we see sa backyard or the
Mm,
piggery. These are genetically modified pigs. And they have modified the genetic makeup of the heart of the pigs. That's why it made it possible to do the transplant. But sadly, I think it just lasted for, if I'm not mistaken, 2 weeks, and then the patient died. There was no written explanation on how the patient died, if it's rejecting the heart or is it the natural cause of his disease. So I really need to
mhm.
dig on it first before commenting on it on the clinical side. But that's the main point. We are trending towards genetically modified organs which are coming from animals like pigs and sheep, which is xenotransplantation.
Yes, doc. So I think also we can also try to improve also the deceased organ donation rates in our country. And also maybe in parallel looking also at the xenotransplantation. Is there a difference in the quality of life or success of transplantation if the organ came from living versus deceased donor?
With the data that we have in NKTI, because we have shorter schema time and we have the machine, there's really not much significant difference. Only a little bit, about mga 3% mas matagal yung sa living donation. The main point why the living donation is have a better survival and graft survival is because it is a controlled atmosphere and everything is in control and you dictate the time, as compared to the disease organ donation where everything is made in haste and you have to consider the wellness of the donor and the recipient. But with the data that we have, it is actually comparable, the survival.
Yes, we can add also, it's not just the donor factor. There
Mhm.
are also recipient factors to be considered. Siyempre, recipients not only have the renal problem, they also have some cardiac problem, di ba? Hypertensive, diabetes. But I have cadaveric recipients of kidneys from cadaver who are 25 years already or 30 years post transplant. So, very important yung recipient factors.
Noted po, Doktora. Last question po. What steps do you think we can take to increase the organ donation rates in our country?
We have zones in the Philippines actually, no, with from the DOH, my zone, my NCR na zone, and this is where HOPE, the human organ preservation effort. We have zone 1, which is in region 1, which is in the area of Pangasinan, zone 2 in the area of the Bicol region, zone 3 in Cebu, Vicente Soto as the head hospital, zone 4 for A, the SPMC in Davao City, and zone 4 for B in Davao Regional Hospital. So we are actually strengthening the program together with the Center for Health Development because we want to increase the donation. So it's not just teaching how the coordinators no, would convince, or their art of convincing the families would be improved, but also to reach out to all hospitals, especially the trauma hospitals, who can refer their cases for donation. So that's what the DOH now is doing, that we would have more. We have to reach out really to other trauma hospitals. And actually, we are convincing the DOH that if the hospital would have that every hospital should have a list of potential donors in their hospital, say report it every month or so. Because if they do not refer, then maybe we can suspend their PhilHealth accreditation. Well, that would be very rough for them. But the point there is we have to educate the Filipino people on organ donation, especially the
Yes.
doctors. Mind
Opo,
you, Christine,
agree.
some doctors
Yes
do
po.
not believe in brain death, no? Isa pa yan. So
Yes.
we are waiting actually for the Philippine Neurological Association to put out their recent guidelines on brain death. Yes, meron na daw silang ginawa-gawa, but as of
Opo.
mga weeks ago, I was asking them, wait muna. Because this should strengthen the definition of brain death if you have these guidelines from the Philippine Neurological Association.
All right. Thank you so much po, Dr. Lequete, Dr. Paraino. Indeed, organ donation and transplantation saves lives. I thank our speakers, Dr. Rosemary Rosete Lequete and Dr. Adolfo Paraino. Through this webinar, we have tackled gaps in knowledge in deceased organ donation and in kidney transplantation, and it's actually the first step in overcoming low transplantation rates in our country. Thank you very much.